Welcome to our NPTE Question of the Day series presented by Typical PT. In today's video, we will be discussing a case about wound care. Here's our scenario. A 70-year-old patient with diabetic neuropathy presents to your physical therapy clinic for balance training. During the session, you notice a dry, shallow wound on the plantar surface of the foot. The patient reports no pain, but expresses concern about keeping the wound clean. The question asks, what dressing would you recommend for this type of wound? Let's look at our options. A. Alginate dressing. B. Hydrogel dressing. C. Wet to dry gauze dressing. D. Foam dressing. All right, pause the video now and try to answer this question on your own. Once you're done, hit play again, and let's check if you got it right. The correct answer is B. Hydrogel dressing. Hydrogel dressing is ideal for dry wounds because it helps rehydrate the wound bed and facilitates autolytic debridement. This is especially important for patients with diabetic neuropathy, where wounds are often dry due to poor circulation and decreased tissue moisture. Since these patients have reduced sensation, they may not notice wounds forming, making it even more crucial to use a dressing that adds moisture and supports healing. Now, let's look at the dressing comparison table from the Physical Therapy Essentials textbook. Remember this mnemonic: awesome heroes fight horribly heinous felons. It helps you recall the order of dressings from most to least absorbent. Let's go through each dressing type. Alginate dressings are highly absorbent. They can absorb 20 to 30 times their own weight. They're used for moderate to heavily exudative wounds during the transition from debridement to repair. However, they should not be used on dry wounds because they do not have hydrating properties and can adhere to the wound bed, causing trauma upon removal. They also do not provide a barrier against bacteria. Therefore, option A, alginate dressing, is incorrect for a dry wound. Hydrofibers maintain a moist wound environment and absorb up to 30 times their weight. They're used for moderate to heavy exudate in wounds such as leg ulcers, pressure injuries, diabetic ulcers, and partial thickness burns. Since our patient's wound is dry, hydrofiber dressings would be too absorbent. Foam dressings are occlusive or semi-occlusive and are permeable to gases and water vapor. They can be used as primary or secondary dressings and are appropriate for pressure ulcers, minor burns, skin grafts, diabetic ulcers, donor sites, venous ulcers, and draining peristomal wounds. They are suited for wounds with moderate exudate. This means option D, foam dressing, is also not appropriate because it absorbs moisture instead of adding it. Finally, hydrogel dressings are amorphous or liquid-like gels containing about 90% water. They maintain a moist wound environment and are used for clean, red ulcers, painful necrotic wounds, donor sites, second-degree burns, and infected wounds. They are especially useful for softening black, dry necrotic tissue and for ulcers with white or yellowish slough on the surface. The key feature here is that hydrogels are for wounds with minimal exudate, meaning they add moisture rather than absorb it. Therefore, option B, hydrogel dressing, is the most appropriate choice for this dry, shallow neuropathic wound.
And finally, the wet to dry dressing, which is our answer choice C. Answer choice C, wet to dry gauze dressing, is incorrect. This isn't even shown on our comparison table because it's considered an outdated technique. Wet to dry dressings can actually damage healthy tissue when they're removed, which goes against modern wound care principles. To summarize, when you encounter a dry wound, especially in a diabetic neuropathy patient, the best choice is hydrogel dressing. It provides moisture, supports autolytic debridement, and promotes an optimal environment for healing. Now that you've gone through this case, take a moment to jot down all the key points in your Typical PT digital notebook. Use it to organize your notes, highlight concepts you found confusing, or mark areas you want to review later. This feature isn't just for note-taking. It can serve as your personal reviewer, helping you track what you've mastered and identify topics you still need to strengthen, ultimately improving your retention and understanding. Thanks for watching today's Question of the Day. We're dropping new NPTE prep content every single day to help you pass with confidence.
Follow us on Instagram, Facebook, and TikTok at Typical PT for daily study tips, quick reviews, and motivation to keep you going.